Hey everyone, welcome back for another deep dive with us. Today we're going to be looking at integrative oncology.
Okay.
We found a really interesting podcast episode on the topic.
Sound good.
And, this is something that I think is really important, especially if you're dealing with cancer or, someone who is.
Yeah.
It's really all about trying to take a more comprehensive and kind of whole person approach
Right.
to dealing with cancer and treatment and, all of the things that go with that.
Exactly. So it's not just about, treating the disease itself.
Yeah.
It's about taking care of the whole person, their physical health, their mental health, emotional well-being, all of that.
Yeah. And from what I understand, a big part of integrative oncology is about using these evidence-based
Right.
complementary therapies alongside conventional treatment.
Exactly.
So it's not about, throwing out
Right.
conventional medicine or anything like that.
No, not at all.
So what would you say are some of the main goals of this approach?
Well, I think one of the biggest goals is to really help patients manage the side effects that often come with conventional cancer treatments.
Okay.
Things like nausea and fatigue,
Yeah.
pain, anxiety, sleep problems.
Why?
It's a lot to deal with. And, conventional treatments can be really tough on the body.
Yeah.
So integrative oncology tries to provide tools and therapies to kind of help alleviate those side effects and improve the overall quality of life for patients.
So it's not just about, living longer.
Right.
It's about, quality of life while you're doing it.
Exactly. Exactly. It's about, helping people thrive,
Yeah.
not just survive
I like that
during
one.
their cancer journey.
So is there anything in the research that you found about, how effective this approach is?
Yeah, there's actually a growing body of research that's showing some really promising results.
That's great.
For example, there was a study published in JAMA Oncology
Okay.
that found that mindfulness-based stress reduction significantly reduced anxiety and depression in breast cancer patients.
Really?
Compared to those who just received usual care.
Wow.
So, that's just one example.
Okay.
But there are many others that show how integrative therapies can really make a difference.
In terms of like actual measurable outcomes?
Right, in terms of, improving symptoms,
Yeah.
improving quality of life, and even potentially reducing healthcare costs.
Wait, reducing healthcare costs.
Yeah.
How does that work?
Well, if you think about it, if people are managing their symptoms better,
Okay.
they might need fewer medications, they might have shorter hospital stays, and all of that can translate into lower overall costs.
That makes sense.
So, it's not just about the individual benefits.
Yeah.
It can actually have a positive impact on the healthcare system as a whole.
So it's not just about, like feeling better.
Right.
It's about actually having,
Tangible outcome.
tangible outcomes like cost and that kind of thing.
Exactly. Exactly.
So I'm curious to learn a little bit more about what some of these specific therapies are.
Yeah.
Can you give me some examples?
Sure. So one therapy that's often used in integrative oncology is acupuncture.
Okay.
And, acupuncture has been around for centuries.
Yeah.
But there's actually a lot of research now
Okay.
that supports its effectiveness for managing things like chemotherapy-induced nausea and vomiting.
Oh, wow.
Yeah, there was a study in the Journal of Clinical Oncology that found that acupuncture reduced nausea severity by as much as 50% in patients undergoing chemo.
50%. That's incredible.
It is. It's pretty remarkable. And, it's a safe and relatively non-invasive therapy.
Yeah.
So it's a great option for a lot of people.
Okay. What about things like anxiety and depression?
Yeah.
Are there therapies that can be helpful for that?
Absolutely. So yoga is another therapy that's often recommended.
Okay.
And yoga, combines physical postures with breathing exercises and mindfulness techniques and
Yeah.
all of those things together can have a really profound impact on mental and emotional well-being.
That makes sense.
Research has shown that regular yoga practice can significantly improve mood, reduce stress hormone levels, and even enhance sleep quality.
Especially during such a stressful time, I imagine that's got to be,
Yeah,
very valuable.
absolutely.
So you mentioned sleep.
Yes.
What about, people who are having trouble sleeping?
Yeah, sleep can be a big problem for cancer patients for various reasons. So integrative oncology offers a lot of different approaches to help improve sleep quality.
Like what?
Things like mindfulness meditation,
Okay.
other relaxation techniques. These can be really helpful for calming the mind,
Yeah.
reducing racing thoughts, and promoting relaxation.
Which is all important for good sleep.
Exactly. And, there's actually a study published in the journal Sleep
Okay.
that found that mindfulness meditation was just as effective as sleep medication.
Wow.
in improving sleep quality in people with insomnia.
That's fascinating. Are there any downsides to mindfulness meditation?
Not really. It's a very safe and gentle practice.
Yeah.
But like any therapy, it's important to find a qualified teacher
Okay.
or practitioner who can guide you properly.
Okay, so we've talked about acupuncture, we've talked
Yeah.
about yoga, we've talked about meditation. What about nutrition?
Oh, nutrition is huge.
Yep.
It's a cornerstone of integrative oncology.
Okay.
It's not just about, maintaining a healthy weight.
Right.
It's also about making sure that your body is getting all the nutrients
Yeah.
that it needs to cope with the stress of cancer and the stress of treatment.
Right, so it's about like fueling your body properly.
Exactly. And a registered dietitian who specializes in oncology nutrition can be a really valuable resource. They can help create a personalized meal plan that addresses your specific needs and challenges.
So it's not just like, eat your vegetables.
No, it's much more tailored than that. It's about, understanding your individual needs, your dietary preferences, any digestive issues you might be having.
Right.
And then creating a plan that works for you.
I think that's really important because, when you're going through something like cancer treatment,
Yeah.
the last thing you want to worry about is,
What you're eating.
what you're eating
Yeah.
or, feeling guilty
Right.
about, not eating the right things.
Exactly.
So just to be sure, so integrative oncology is not about rejecting conventional treatments.
No, not at all.
Okay.
It's about integrating the best of both worlds.
Got it.
So conventional treatments like surgery, chemotherapy, radiation,
Yeah.
those remain, the cornerstone of cancer care.
Okay.
But integrative therapies work alongside them to address the whole person.
Okay, so if someone is listening and they think this is something they want to explore,
Yeah.
what should they do?
The best thing to do is talk to their doctor
Okay.
or a qualified integrative oncology practitioner.
Is that a different thing?
Sometimes it's a doctor who has specialized training in integrative oncology.
Oh.
Sometimes it's a separate practitioner
Okay.
who works in collaboration with the doctor.
Got it.
But either way, it's important to find someone who you trust and who can help you navigate this approach.
And help you figure out, which of these therapies might be right for you.
Exactly, because not every therapy is right for every person.
Right.
It's really about finding what works best for you.
Okay, great.
Yep.
So we've learned a lot about integrative oncology today.
We have.
I think the biggest takeaways for me are that it's really about, taking a holistic approach.
The whole person.
Treating the whole person, not just the disease.
Exactly.
And using these evidence-based complementary therapies alongside conventional treatments to really improve, quality of life.
Absolutely. And empower patients to take a more active role in their own healing process.
That's great. So I guess the question for our listeners is, what aspects of integrative oncology resonate most with you?
Yeah.
And how might these approaches, even beyond cancer care, contribute to a more holistic approach to well-being?
That's a great question.
In your own life.
Yeah.
Something to think about.
Definitely.
Thanks for joining us on this deep dive into integrative oncology.
Thanks for having me.
We hope you found it informative and helpful, and we'll see you next time.
Bye.